FND, Functional Neurological Disorder. That's the topic for today, guys. I am Giri Srinivasan, registered physiotherapist from InStep Physical Therapy, Edmonton. Today, we're going to discuss about how neurological physiotherapy will help FND patients, functional neurological disorder patients. Before, I've been practicing this for more than 20 years now. Before, we used to see maybe 2 or 3 FND cases in a year. Would you believe if I say I saw 15 to 20 FND in the last 2 months alone? It is really overwhelming, and I was like, what is going on? I'm trying to connect the dots. Why everybody's coming out of the blues now? So then we're going to discuss why later in this presentation about that. Again, as I mentioned, I'm Giri Srinivasan, registered physical therapist, and also a lot of experience in neurological physiotherapy, and a proud professional member of Functional Neurological Disorder Society. And if you are an FND patient, please check out the website. You'll get a lot of valuable resources and information from that. Let's get into the presentation now. What is FND? Functional neurological disorder is very reflexive, involuntary response the body has learned. It's a little glitch in the body-brain connection, but it can be completely retrained. It is a software problem. It is not a hardware problem, right? Software means a functional problem. There's a functional problem in your nervous system, but nothing wrong structurally. Hardware is nice and safe. That is called FND. There is a lot of stigma around FND, and this slide is to explain about that stigma in the community, right? What is the impact of the stigma when the FND patient goes to see a doctor or a neurologist? Neurologists mostly aware of these things, but sometimes other medical professionals who are not aware of FND symptoms, this is what they go through, right? They go to the doctor to take some help, and then they do some checking in the medical field and they say it's not real, right? And the patient feels so invalidated and angry and frustrated and confused. Why nobody's believing me? That's the worst situation, a worst feeling you can have as a patient. Then what happens? The lack of communication between the patient and the healthcare team, and trust is broken. When the trust is broken in the medical field, in the healthcare field, everything is broken, right? And then provider says, okay, this patient is very difficult to manage, and the provider does not take any steps to learn more about FND. It's a separate world out there. And North America is very behind in FND kind of approaches on the resources compared to UK, right? UK is far more advanced in FND treatments and the research and also education to the patients and the providers, right? So this is what we don't want. Come out of that stigma and then take real help, approach real people who knows about FND to get yourself better and get out of that. So a small slide from FND Australia. Again, FND Australia is great, beautiful site, which I always refer to my patients as well for education purposes. And they have this nice slide here to talk about what is functional neurological disorders in one small infographic here. You can see what is FND is and what are the symptoms you can have with FND. You can have mixed variety of symptoms from upper limb weakness, lower limb weakness, hand weakness, grip weakness, or sometimes it can present as one side is paralysis. Sometimes it can be one arm and one leg. There will be a lot of gait disturbances. There's a lot of ataxic gait, wide base gait, limping gait. You can also see patients, they'll be walking and they'll be buckling every 2 steps, or they will be coming and walking, they stand, when they stand they might go this way or they might go that way. There's so many different gait disturbances we have seen in FND in our patient presentations, and it's much more common in women than men. I have maybe 2 male patients, everybody else is a female patients, and we do also pediatric patients as well. I have about 3 or 4 patients under 15 with FND. We're going to talk about pediatric FND also in this presentation, right? And then your tremors, muscle spasm, myoclonic twitches is also another important characteristics. It can be on the face, it can be in the hands or the feet, just the toes. It can be in different places. Functional seizures also another important thing. We'll talk about that later. Abnormal movement patterns. Suddenly they'll go like this, right? So kind of a dystonic abnormal movements can also be there. And it also can come from the neck also. Speech disturbances, slurred speech, or searching for the words in between, right? And swallowing difficulty is also very common. And continence issue may also be present. So there's a whole bunch of things can come with your functional neurological disorder as a symptoms. Diagnosis, like usually it's kind of, you exclude a lot of neurological problems by a neurologist or neurophysio. A lot of things will be excluded. What we'll do for upper motor neuron and the lower motor neuron test, we do all those things, we exclude most of the things. And there are some positive signs in the diagnostic criteria to diagnose somebody as FND. And that if you search diagnostic criteria for FND, you will know those 5 points as well on that one. So there is no quick fix for FND. It's a multidisciplinary team approach. Okay, the team consists of family doctor, neurologist, neuropsychiatrist, psychiatrist, psychologist, physiotherapist, occupational therapist, speech language pathologist, social worker, patient, family members, school, everything is involved in this team, multidisciplinary team. Then only you can get better success with the FND patients. And outcomes can vary. Children actually improves a little bit faster than the adults, and depends also how far you've been without treatment, how strong your abnormal movement patterns are, and how strong your beliefs and apprehensions are. It all depends on those things. InStep FND program. What we offer at InStep Physical Therapy for the patients with FND. We have team of neurological physiotherapists with various post-graduations in neurology, and also about more than 20 years of experience in neurological patients. We treat multitude of patient conditions like stroke, multiple sclerosis, Parkinson's, spinal cord injury, hydrocephalus, you name it, pediatric and adult neuro conditions. We've been doing this for 20 years. And we have great team behind, and also FND educated. We have done courses on FND. We are certified in so many FND related things, including cognitive functional therapy and things like that. So we can help you with those things. And most of our physiotherapy assistants are basically foreign trained physiotherapists who are in their way to become a physiotherapist in Canada. So they have immense knowledge, and they are helping us as physiotherapy assistants right now on their way to become a physiotherapist. So they're also very well trained in neuro rehabilitation. Psychologists, we have wonderful professional psychologists who works very well with a lot of clients, FND clients, in cognitive behavioral therapy. That's something she does very often. And cognitive behavioral therapy is one of that evidence-based approach based on the consensus for FND for treatment. And we do have offsite OT and speech language pathologist team, which we refer to if we need OT SLP help. And our clinic is designed, our infrastructure, our human resources, everything is designed to accommodate neurological patients, parallel bars, low mats, and whatever you think, the assistance, everything you need as a neurological patient of our clinic. And that is InStep FND program. This is the team, and I'm going to talk to you about what is our approach is. What can you expect from InStep Physiotherapy when you come here as a patient who's diagnosed with FND, whether it's adult or pediatric, right? You can expect a very thorough subjective examination. Subjective examination is very important in this condition to identify a lot of key factors, a lot of predisposing factors, precipitating factors, and biological factors and social factors in this condition. So our assessment is very well psychologically informed and also cognitive functional therapy based neurological evaluation. Then we have questionnaires, FND questionnaires specifically for you to fill out to get more information from you, from first-hand information. We will give you FND patient workbook to work with, to log in all the things you do, how to pace your activities every day, putting your goals, tracking your progress, and also with a lot of resource links to important resources you should know to educate yourself, and if you're a parent, to educate the parent to work with the child very efficiently. And we believe in education and empowerment, and that's the whole reason for this topic we are discussing today. We love to educate and empower people. There is nothing more I can give as a registered physiotherapist than a wonderful evidence-based knowledge to the community and to the people who are suffering from FND. And we believe in that. And we are also big on pain neuroscience education. We are updating ourselves like really good. Spend a lot of time in pain neuroscience education to learn, and also how to teach someone, how to educate someone as a patient who comes with pain. It can be an acute pain or chronic pain, or it can be a functional pain, which a lot of people with FND will go through that. Right now, I'm working with a 9-year-old boy who has a lot of functional pain in his thighs, which he developed after his viral infection. His pain is 9 or 10 out of 10. We are working with him right now. And it is challenging, but we take on those challenges to make them better. Movement retraining is a key thing for neuro physiotherapy. Not only for FND, we do that for all neurological conditions. For FND, it's much more important because you're working with abnormal movement patterns which happens involuntarily. You got to take that, you got to identify that, and you got to retrain that movement. How you do movement retraining? You're going to talk a little bit later in detail, and you're going to also a demo like of sit to stand, how we break that into sequence and how we work on it. I'm going to show you a demo on that as well. Movement retraining is very important to take patients away from all the abnormally learned movement patterns and driven by attention and also expectation. As I told you before, cognitive behavioral therapy, our physiotherapists also trained in that, and most of the times we refer those patients to our psychologists who can work with the patients for cognitive behavioral therapy as well. For pediatrics, we do something called REACT. It's nothing but retraining and control therapy. It's a proven model for FND pediatric patients, right? It's mainly to target the sense of control, attention to the symptoms, and also symptom expectations and changing of behavior. So that is called REACT. And this is all our approach for FND and more. I just put the main points in there. We do much more than just what you guys do. And everybody gets a home program. They can work on their own and also with a caregiver if they have to, and make it more fun and enjoyable and very patient-centered and goal-oriented for our FND patients. Pediatric FND, Pediatric Functional Neurological Disorder. It happens to kids as well. And there is a lot of predisposing and precipitating factors will come as a kid. It can be stress in the family, fighting between dad and mom, or between siblings, or kids are ignored at the home, not a lot of social things happening at home. It can be bothered at school, bullying, or stress from school. It could be anything, right? Can cause some things as a precipitating factor. It can be an illness. Kids could have been fractured or fell and broken a leg. Could have been the cast for a while. Could have been a concussion. Could have been a sports injury. So many precipitating factors are there. And I'll show you a slide later to kind of explain all those things. So that can cause FND sometimes. These kind of patients, we have a plan for the patient, plan for the parent, plan for the school. So we got to cover all the areas. So patient plan would kind of mostly involve in how to train them in developing competing thoughts and competing movement patterns compared to what they are projecting with abnormal movement patterns and abnormal thought processes. So that's a big process. It's explained very simply in 2 words, but it's a process to go through that. And habit reversal techniques and plan for the parent. All the kids I see with the FND here, I have a session with a child or a kid, and then I'll take the mom or dad to my room separately. So we'll have discussed a plan for the parents, how parents has to deal with it, what they should encourage, what they should discourage, how they should support the child, okay? And make sure the child is in a safe environment. At the same time, you cannot focus too much on the abnormal movement patterns. There is a way to approach this condition. We educate the parents on that. Then we'll have a plan for the school. So this is when the people can return to school. What kind of approaches school should have, the teachers and the fellow students, what kind of approach they should have. We have a plan for that, so that we can work as a team towards the well-being of the kid. And that's exactly what we do. And also we use treatment determination tool to identify and individualize the sessions, individualize the treatment plan. That's very important. How often this kid having FND symptoms, what triggers it, when it comes on, how long does it stay, when is the last time it came. So all those things, if you identify those things, you can have a tailor-made treatment program for pediatric FND. I told earlier in this presentation about I'm seeing a lot of FND patients now in the last 2-3 months compared to what I did every year before. I'm thinking, any connections? And one small connection with the adult patients could be COVID. I don't know. Could be what everything changed during COVID time, the social isolation, emotional stress, financial stress, family stress, problems between husband and wife, between dad and mom and kids. Could be that factor that all those people went through that in the last 2 years when we suffered from COVID, and people obviously have to wait to see a neurologist to get a diagnosis. Maybe it took that time for them now. Now everybody is going to the K clinic in Edmonton or seeing a neurologist in the neurological clinic. Now we are getting those flow of patients coming into our clinic. It's raining FND, I should say. So why? I'm just thinking this might be one of the reasons, because COVID has cluster of symptoms, right? There's more than 200 symptoms in the post-COVID syndrome. And we also treat a lot of post-COVID patients. Post-COVID patients, just as it is, post-COVID patient with POTS and vagus nerve problems and anxiety, depression, that area, plus also FND. Right? I'm just trying to think as a clinician, what could be the reason in this province or in Edmonton? Why suddenly everybody's coming out? What could be the connections? I'm just brainstorming myself, and this might be one of the reasons I'm thinking, with all the anxiety building up, the depressions, how many people are not sleeping very well, late nights, video games, and sleep deprivation is also one of the predisposing factor for FND, because your sleeping is your brain cleaning time. Every night you have to give yourself good cleaning time. If not, the abnormal proteins can accumulate in your brain, can disturb your processing a little bit as well. This slide here explains you the triggering events. What are the different triggering events? What are the predisposing factors? So first we're going to see some of the predisposing factors. Any kind of functional disorders. It can be a pain syndromes, chronic pain syndrome, sometimes fibromyalgia, irritable bowel syndromes. It can be one of the predisposing factor. Neurological conditions, a lot of migraines, anxiety, depressions, stressful life events. It can be anything in your family or in your friend's family, in your school or workplace. And we all went through that during COVID time, don't we? A lot of stressful life events, right? And a lot of anxiety and depression. Childhood adversity. Also, kids went through a lot and trying to put a 3-4-year-old with a mask on their face, right? And what are the restrictions they should have? Okay, they can't have birthday parties. How many things kids went through? Yes, you can connect all those dots, right? Sometimes no vulnerability is also a predisposing factor. What are the triggering events, right? You can see in the slide there, any kind of injury. It can be a orthopedic injury or a neurological injury or a sports injury, concussion, all those injuries, right, can also be a triggering event. Right now, I have 2 or 3 motor vehicle accident patients develop FND. I'm treating them right now. So motor vehicle accident, in another 1 year, they develop FND symptoms and I'm treating them for that. So that can also happen. It can be a workplace injury, panic attacks, migraines, neurological illnesses, and also a lot of side effects as a drug. If you're heavily medicated for your lot of issues, side effects can cause, right? And head injuries and concussion we already talked about, right? What are the comorbidities? What are the things can kind of bring it together, right? Depressions, anxiety, post-traumatic stress disorder, right? Sleep problems, I told you already, sleep is very, very important. Please make sure you get enough sleep in there. And dissociations and avoidance, that's all happened during the COVID also, the social isolation. And a lot of people are working from home. I treat a lot of patients working from home. They have their own problems, but everybody misses that social connection, what you have in the office, seeing your colleague face to face. When you see your colleague face to face, you secrete different neurohormones with the eye contact with the face to face. You don't do that when you do that on the screen. It's not the same. So if you have an opportunity to go to your office to work from office, do that. If not every day, at least 2-3 times. Just don't engulf yourself just at home in front of the screen. That's very important. We are social animals. We need to see people, talk to people, right? That's very, very important. And what are the perpetuating factors? Feeling disbelieved about yourself, about your goals, about your condition, right? And also misdiagnosis. And FND patients usually get misdiagnosed in the beginning and then they slowly later, 6 months, 8 months down the road, they come and being assessed and properly assessed and then diagnosed as FND. A lot of medications, opioids, and a lot of sedative medications, right? A lot of antidepressants and things like that to just work so much with your cocktail of the neurohormones, how they mess it up. Unnecessary surgery, right? For everything, we don't have to put a knife on our body. 90% of the carpal tunnels can be relieved by proper exercises and physiotherapy. You don't need surgery for everything. You don't have to wear splint on both hands every day. So all those things, right? And for a lot of your shoulder and knee conditions, it can be treated. A lot of evidence out there, it can be treated very effectively with conservative management without surgery. You have to educate yourself on that. Legal cases, if you're in legal trouble and that emotional stress, and that also can cause as a perpetuating factor. So treatment is basically an InStep FND approach. We have a great InStep FND team and understanding of the disorder and work with the multidisciplinary approach, collaborative approach, and also treatment of the comorbidities. And also we have a lot of education on the social approach also. We talk about your social life, your sleep patterns, your diet patterns, and your exercise patterns, lifestyle factors. It's all important. Everything comes in. Okay, some people recover completely, some people recover partially. Hopefully everybody recovers to a certain extent. And some people and then go back to work again and we have life goals achieved again. These are the things we do for InStep FND program. So we're going to see a demo for movement retraining. Before seeing the demo, I'm going to explain the theoretical basis of movement retraining, which all the neuro physios do, especially FND is very, very important. So what are the targets for the movement retraining? What we target? Number one, we redirect attention. That's very important in FND. And redirect attention, how to create automatic movements and how to kind of redirect attention from the abnormal movement patterns. That's number one. Number two, change expectations and belief, right? And that's where the patient education is much, much more important. FND is real condition and FND is treatable condition. And also what can you expect? That's very important patient education we do and through movement retraining. Reduce the threat value of symptoms, right?